I'm instructing my administration to halt funding of the World Health Organization while a review is conducted.
There's been sharp reaction to the United States' decision to pause funding to the World Health Organization. Plus, why are so many African Americans dying from COVID-19? Hello, I'm Anand Naidu, and this is The Heat. President Trump's decision to halt funding to the WHO pending a review of its handling of the COVID-19 crisis sent shockwaves around the world, with global confirmed cases now topping 2 million deaths, over 130,000. Some have questioned the timing of the US announcement. For the latest, we turn now to CGTN's Nathan King. He's at the White House. So Nathan, what's the fallout from this drastic announcement?
Well, as you can imagine, the condemnation was not just international, but domestic too. Jimmy Carter, the former president, issued a statement condemning the move. And the second biggest funder of the United States is not a nation. It's the Bill and Melinda Gates Foundation. Bill Gates also condemning the move as well. Quite a lot of just head scratching of why the US president, in the middle of a pandemic, would cut funding to the global organization best prepared to actually help not just developing countries, but also the US. Remember, the WHO had a test long before the US had a test that didn't work, and then they had to spend many weeks doing it. But, you know, the US president is very good at deflecting blame. We look at the cases of 600,000, the death toll nearly 30,000 now, and he's doubling down. Let's just take a listen.
Tragically, other nations put their trust in the WHO, and they didn't do any form of ban. And you see what happened to Italy, you see what happened to Spain, you see what happened to France. WHO's guidance had failed to control their borders at a very crucial phase, quickly unleashing the contagion around the world. That was a horrible, tragic mistake, or perhaps they knew.
I mean, there's so many allegations in there, but let's just say one thing for sure. The WHO doesn't like travel bans, but didn't tell the US not to do it. The reason they don't like it is they don't think they're very effective and that they give a false sense of security sometimes. And when the president actually put in his partial ban of travel from China, there was already community spread here. And as many White House journalists and other officials have said, the entire month of February, really nothing more was done other than that travel ban. So essentially, when we look at the high number of cases here and the climbing death toll, his point actually proves the WHO kind of right.
Nathan, one other issue here in the United States, there's been a lot of talk about reopening the country, reopening the economy.
Yes.
What more do we know?
Well, there's going to be an announcement on new sort of social distancing rules and the US president's plan for reopening the economy. He just said in the Rose Garden behind me here that he thinks 20 or up to 29 states could be partially reopened. Now, there's been this big tussle with the governors. He sort of gave in to that and said, look, governors can come up with their own plans. But the problem here is testing. Many states are not going to open back up straight away unless they can test a significant part of their population. Also antibody testing, contact tracing, all the stuff that we've been seeing in Asia for months. And a lot of business leaders are actually on the phone with him behind closed doors today saying exactly that. Now, it's going to be very interesting to see what he unveils. We know that he wants the US economy to be open again. He talked about Easter. Now, the May the 1st is the date we're hearing, but he wants to get some states open up before that. The problem is if people start moving around very quickly, his medical advisors have said, you know, we are going to see a spike in cases. It's going to be very interesting to see how his plan is actually translatable on the ground. It really has to come up from the ground up, doesn't it? I mean, people have to be ready to go back to work and know that they're going to be healthy.
Thanks, Nathan. That's CGTN's Nathan King reporting from the White House. Well, there's much to talk about. Let's get right to our panel. Victor Gao joins us from Beijing. He's Vice President of the Center for China and Globalization. John Sitilides is in Virginia. He's a geopolitical analyst and consultant to the U.S. State Department. And with us from Washington, D.C. is the senior news editor for U.S. News and World Report, Joseph Williams. Thanks to all of you for joining us. And let's talk about that White House decision to halt funding to the WHO. Joseph, President Trump has been critical of the WHO for some time now. He mentions it very often in those press conferences that he holds. But why do you think he took that drastic action right now?
It's puzzling on its face. I mean, logically speaking, it seems like a counterintuitive move at best. But if you look over the long history of President Donald Trump, it actually starts to look logical in this sort of sphere of illogical behavior. It's kind of a bait and switch. As your correspondent said earlier, President Trump is very good at deflecting blame, and especially good at deflecting blame when it involves foreign countries. The WHO is kind of a mysterious organization that a lot of Americans don't have a lot of familiarity with. They do understand that it is transnational, and that kind of raises hackles of paranoia among Trump's strongest supporters. The problem here is that the WHO didn't necessarily behave flawlessly in response to the pandemic. It was a little too deferential to China when the pandemic first broke out. And ironically, they were echoing, or Trump was echoing, a lot of what the WHO was saying in praising China and how it handled the pandemic. So you have two real parallel lines here that the president is trying to connect. One is his great, I don't want to say, one is his very determined enemy, his adversary, China. The other is an international organization that a lot of people don't know very much about. You put the two of them together and you have a perfect kind of excuse to stop talking about Trump's own shortcomings in this response and blame it on someone else.
All right, let me bring in Victor Gar from Beijing. Victor, President Trump's main complaint against the WHO was that it took China's claims about the coronavirus at face value and that it also failed to share critical information about the outbreak, the viral outbreak at the time. China, for its part, has expressed very serious concerns about this latest turn of events. What do you make of it?
Well, first of all, President Trump's decision to defund the WHO cannot happen at the worst time. And this decision is a tragedy, and it is really a man-made tragedy. And it will make mankind's fight against coronavirus 19 much more difficult to achieve a positive goal. Secondly, China reported to WHO as early as the end of December last year. And since the beginning of January, China has kept in constant contact with WHO, disclosing to WHO the whole genome sequence of the coronavirus that China scrambled in a matter of a couple of weeks to discover. And by reporting to WHO, all the member states, up to about 200 member states of the WHO, all had the benefit of the scientific discovery disclosed by China. So this really helped mankind and the world as a whole to gain insight into this particular very deadly virus and to prepare all the scientific and technological efforts in terms of vaccine, etc. So I think WHO was a very important pillar in the global fight against coronavirus. It should be protected rather than destroyed or undermined by the United States.
All right, let me get John's view on this. John, the president's decision has been universally criticized. Even U.S. allies have been criticizing this. In fact, here in the United States, the American Medical Association called it a, quote, dangerous step in the wrong direction. Bill Gates, whose foundation is the second biggest contributor of funds to the WHO, he said that if the WHO's work is stopped, no other organization can replace them. So one has to ask why the president did this at this time in the midst of a pandemic.
Well, Anna, let's begin by noting that it has not been universally condemned. The president has many critics in Washington, in the U.S., and around the world, but there are many Americans, Republicans and Democrats, who feel this was the right decision to make at this time. The WHO, under the leadership of Director General Tedros, has been rather obsequious to Beijing. It has been unable since January, the beginning of January, to obtain and to secure data, facts, information about the origins of the virus in Wuhan, You see now the Chinese government is censoring any research publications about the origins, and the WHO has been absolutely unable to perform its job effectively and to carry out its mission to share this data that it's supposed to be obtaining from countries where a virus breaks out with doctors, with physicians, with health organizations around the world. So Dr. Tedros has made very clear that he is an incompetent and inept leader of a critical organization. So I don't think the president's decision is necessarily a slap against the WHO if it performs its mission properly, as it did in 2003 with the SARS outbreak under the leadership of President Hu Jintao in China. The problem is the current leadership, and what the president is doing is saying, let's put a halt on funding for now. Let's get a better understanding of what's happening inside the WHO because A, we have to defeat this coronavirus right now. We also must make sure we never face this kind of a global pandemic that crushes economies around the world. I mean, the world economy is in a global recession for the remainder of 2020. So maybe it's time to reform the WHO. Maybe it's time to replace it. It depends. But let's put a halt on funding, and all of these other governments that are concerned about funding, they can step up to the plate and make up for the US shortfall.
Okay, Joseph, what do you make of that? John telling us that the main reason for the halt in funding here was because the WHO Director General, Tedros Ghebreyesus, the doctor there, is inept, incompetent.
Well, first and foremost, let's set aside, or let's assume for the sake of argument that what those allegations he made are true. Is now the proper time to do that? I would suggest that reassessing the role of the WHO and maybe focusing on the criticism probably makes more sense as an after-action report, not right in the middle of a pandemic. I mean, say what you will about the organization, it still performs a vital function around the world. Not to mention the fact that the United States is perhaps the biggest single contributor, and not funding it even temporarily during the pandemic cripples the organization and hamstrings any kind of research, any kind of cooperation it might have with other countries. So let's assume, assuming that those arguments are true, now is not the time to do that. And a lot of people would take issue with a lot of those arguments, mostly because President Trump himself echoed a lot of the praise the WHO had for China and was very much on board when China was not the WHO's target.
Right.
So I think it's kind of specious to suggest that he's doing this out of a great sense of moral obligation or outrage, and more appropriate to suggest that it is something that does take the heat off of President Trump himself, and it's a move that we've seen before with this administration.
Okay, Victor Gao, there has been a response from China. The Chinese Foreign Ministry has been talking about this. Here's what the spokesman in Beijing had to say. Let's listen.
The current global pandemic situation is grave. This is a critical moment. The US decision will weaken the WHO's ability to handle the pandemic and will undermine the international cooperation against COVID-19. All nations, including the United States, will suffer from the impact of the decision, especially the countries whose capabilities are not well developed. We urge the US side to practically fulfill its responsibilities and obligations and support the WHO-led international action against the epidemic.
Victor, a number of international leaders say that they rely on the WHO to provide the kind of information they need to deal with this pandemic. The question is, how badly will this shortfall in funding affect the WHO's ability to do its job?
Well, first of all, WHO is indispensable in the current fight against the pandemic, and especially for the developing countries, which account for the majority of the population of mankind.
Right.
Secondly, whatever the United States is doing is not constructive to the fundamental interests of the Americans to start with, and is very detrimental to WHO as an organization and to the fundamental interests of mankind at large. Therefore, I think we need to appeal to the sensibilities and the decencies and the sound judgment of the American people, and the American people and the American government. Don't be hijacked by one single individual. That's wrong and that's indecent, and I think that should be condemned universally by mankind.
Okay, and I have one final issue which I want to raise. And Joseph, you and I talked about this in our podcast a few days ago. We talked about how this pandemic will kill more African Americans proportionately than whites. What is the main reason for this disparity?
Well, to be succinct, the main reason is that being black in America is almost a pre-existing condition, mostly because statistically we're more likely to have underlying conditions that will react badly to the coronavirus. We are in less access. We have less access to hospitals and medical care, and we have jobs that tend not to attach medical care as a benefit. Setting that aside, we also have conditions that make it much more difficult to quarantine and stay 6 feet away from people in social distancing. There's a lot of misinformation out there as well. And we have no real understanding of testing here in the United States. We don't have tests that can confirm who is a carrier and who isn't. So there's a host of factors, and most of them have to do with structural racism in the United States. Now, it's not the only factor, but certainly it is one of the primary reasons why the death rate is so much higher. And the coronavirus has pulled back kind of a veneer of equality that we've had in the United States and exposed some real inequalities that are underneath and that we have to address going forward.
Okay, and we have to leave it there. Thanks to all our guests for being on the panel. Before we get to our next panel, as we said, the coronavirus pandemic is disproportionately infecting and killing African Americans. I spoke earlier with Jason Nichols. He teaches African American Studies at the University of Maryland, and with Stephen Thomas, who heads the Maryland Center for Health Equity. Stephen Thomas, let me start with you. There's a report out by the McKinsey consultancy which says that there will be more blacks who will die from COVID-19 in the United States than whites, despite the fact that blacks are in the minority in this country. If we look at the state of Louisiana, for example, blacks account for 44% of deaths, although they are only a quarter of the population. And we're seeing a similar pattern in other places like Chicago, Milwaukee, even in New York State. How does one explain this disparity?
Well, you know, it's both disturbing and not a surprise. The fact of the matter is that the conditions that make one at increased risk for very, very negative outcomes associated with COVID-19 are the underlying conditions, the cardiovascular disease, the type 2 diabetes, the asthma. We call these diseases health disparities, and the gap between blacks and white and other minorities on these disparities have been in existence for decades. In fact, it would be easy to ignore were it not so well documented that issues of structural inequality, racism, discrimination, even bias in the healthcare delivery system have all contributed to the persistence of these racial and ethnic health disparities. Now COVID-19 arrives and exposes this vulnerability in ways that are shocking to America.
Jason, let me get your view on this. That same survey that I referred to, the McKinsey survey, showed that black Americans are more likely than their white counterparts to have health conditions, as Stephen just pointed out to us, that exacerbate the effects of the virus. And this, of course, points to inequalities in healthcare. It points to other conditions as well, which far predate the virus outbreak, doesn't it?
Yes, and I would say it's certainly an issue with healthcare, and we need healthcare professionals that understand, you know, the issues with everyday racism that, you know, involve asking questions to patients. People don't believe black people experience pain in the same ways. They've done surveys where even healthcare professionals don't understand simple things about, you know, the social construction of race. But the thing that I would also point to is that there's, just as your last guest talked about, is that black people breathe lower quality air, they drink lower quality water, oftentimes they can live in food deserts where they eat lower quality food. So all of this goes beyond just healthcare to create these health outcomes. It goes back to the very root of systemic racism and institutionalized racism, which goes back to the very basic things, living in, you know, shelter that's fit for human beings. So again, when you've got, you know, mold in houses like we have here where I'm from in Baltimore City, which is a place where they're saying that COVID-19 is going to strike really badly, and you have that on top of the fact that you have poor health care, you're going to create, and you have poor health outcomes. It creates a terrible situation for Black people. And as we've said, many times, America gets a cold, African Americans get the flu. And in this case, they're getting COVID-19, and it's having really destructive effects.
Yeah, in fact, there was a journalist that I spoke to a few days ago. He said when America gets a cold, Black Americans get pneumonia. Stephen, Dr. Anthony Fauci, I mean, this is something that is recognized in the country. Dr. Anthony Fauci, whom we've seen a lot of on television, he's the director of the National Institutes of Health. He recently said that, look, the country recognizes this huge disparity between blacks and whites, but he said nothing can be done about it at this stage except to give Black people the best possible care. What do you make of that?
Well, he may well be right. That my sense is that as long as these health disparities could be sequestered, in zip codes of racially segregated neighborhoods, it wasn't about people not being aware. I'm talking about people in power that could actually make a difference. It was about, do they care? And that's what the issue is. Those of us who have been in the trenches on the front line for the past 25, 30 years, ringing the bell, raising the alarm that these health disparities don't only affect Black people, they actually affect the quality of life for the entire country. As racial and ethnic minorities increasingly become the majority in our society, the health status of the United States will be defined by that group. And so this is a wake-up call. This is an opportunity to recognize that we cannot allow COVID-19 to become endemic and live in any one of these racially segregated neighborhoods. We truly are all in this together, but we cannot embrace that and find solutions for all of us if we are colorblind, if we continue to fail to provide African Americans and other minorities the opportunity to be tested, the opportunity to get good treatment, and a recognition that on the other side of this pandemic, there must be a massive investment in eliminating racial and ethnic health disparities.
Do you think that's going to happen, Stephen, or are we going to slide back into what we consider normal?
I've asked myself that question, and the answer that comes back to me is that this is truly unprecedented. This is truly an example of how an infectious disease can actually destroy a society. It would not be the first time. I believe we are resilient, but look what we're up against, especially here in the African American community. Right now, as I'm speaking to you in Prince George's County, Maryland, which is inside the Capitol Beltway, I am 9 miles from the White House. Prince George's County, Maryland is the epicenter of the epidemic in the state of Maryland. And I'm just very concerned that I have a network of barbershops and beauty salons that we work in to address health disparities, and my barbers are sending me flyers that they're seeing being circulated in Black neighborhoods saying that COVID-19 is a conspiracy theory, telling African Americans, don't be tested, don't take the vaccine.
Jason, we've seen the consequences of this virus outbreak in two ways. There's the health consequences, we've seen that, and also the economic one. The Black community has also taken a disproportionate hit when it comes to the economic conditions. This is what Trevor Logan, who is an economics professor at Ohio State University, this is what he had to say. Let's listen.
I think that the biggest threats are, first, the existential threat of high rates of infection and high rates of death is issue number one. And then second, on the other side of this is the potential prolonged economic devastation of the African American community. And this is where issues such as racial wealth and income inequality really come to the fore. African Americans don't have, on average, the type of cushion that allow them to weather these sorts of economic catastrophes. They just do not.
Jason, fair point?
I think it's a very fair point. I think, again, the most important thing, as Trevor Logan pointed out, is the existential threat and the threat to health and to livelihood and to quality of life. But there's also the economic threat. We have to remember, there was a study in Boston that white Americans are worth about $250,000. African Americans are worth $8 on average. We have a serious economic issue in African American communities across the country. We're almost in a constant state of economic recession or depression. There was a study that came out a while ago that said that African Americans, 20% of African Americans didn't have a bank account, many have zero savings. So when you have an economic calamity on top of this health issue, where it's going to affect, people's jobs, and people are losing jobs, and more people are having to go on to some form of public assistance, it's absolutely going to hurt African Americans more. And so when I said that thing about, African Americans, getting the flu, or in your case, you said pneumonia. Yeah. That also extends into other things besides just health. It extends to the economic consequences of something like COVID-19.
Stephen, are there adequate healthcare facilities, healthcare infrastructure to deal with this kind of disparity that we're talking about right now?
Listen, we've gone through a period of consolidation of our healthcare system in ways that now expose the fact that we cannot handle surge. The fact that we cannot handle surge. I think it's very, very problematic. And my concern is that we're not getting the message to these minority communities. And my barbers are emailing me and saying, hey, people are having parties. They think social distancing means stay away from strangers. But my buddy Pookie could come over and we're going to have a barbecue. They're not getting the message. They're also afraid, even before COVID-19, afraid that somehow going to the hospital would result in charges and expenses that they could not pay. So they delay going to the doctor. They delay going to the hospital until it's so bad that many of the treatments we have available don't work. And let's not forget our Latino brothers and sisters who, even before COVID-19, were facing potential discrimination, potential harassment by ICE and others, wondering if they're documented or undocumented, and fearful of going into facilities like healthcare facilities where they would be potentially deported. All of these things are now coming back to haunt us. They're coming back to haunt us because we need to not only deal with the message, we need to also address the messenger. Who are the credible messengers to bring information to minority communities?
Stephen Thomas, Jason Nichols, thanks to both of you for being with us.
Thank you.
Thank you.
And that's it for this edition of The Heat. I'm Arnold Neidem in Washington, D.C. Thanks for being with us.